Don't transfuse more than one red cell unit at a time when transfusion is required in stable, non-bleeding hospitalized patients. When considering red blood cell transfusions, the decision to transfuse a patient should be based upon both the hemoglobin level as well as the clinical assessment of the patient. There is now a great deal of evidence that a more restrictive transfusion approach is not only appropriate in most stable, non-bleeding hospitalized patients, but in some cases may lead to improved clinical outcomes. For example, transfusing a single unit of red blood cells to stable, non-bleeding anemic patients is sufficient in most cases to address the patient's symptoms and raise the hemoglobin to an acceptable level. Transfusing a single unit of red blood cells and then rechecking the hemoglobin and reassessing the patient clinically before considering transfusion of a second unit is now considered the standard of care for safe and responsible transfusion practice in most stable, non-bleeding patients. In fact, transfusing less blood in this patient population reduces the risk of some transfusion-associated adverse events, reduces overall blood use, and saves this valuable and limited resource for those patients who truly need it. Choosing Wisely Canada recommends to transfuse one red cell unit at a time when transfusion is required in stable, non-bleeding hospitalized patients.